All right, are we live?
No, yes, we are.
All right. Hello, everyone. Welcome to our Diaspora Dialogue. My name is Christy Jones, and I am the event director here at African Ancestry Link. We are so excited to go live with you today. The topic of conversation is our organization. Who are we, and what are we all about? So we're going to get into that conversation with you today. First, I'm going to start with a question for Princess, our CEO and executive director. Princess, what inspired you to start African Ancestry Link, and how has your journey influenced its vision?
Thank you, Christy, for that question. Being an African immigrant that came to the United States, there are so many things in my mind coming from Africa, not DNA. In Africa, we don't talk about DNA enough. It's not that we don't know what DNA is all about, but we don't talk about it. We talk about DNA when we want to find out, maybe a man wants to find out if his or her child, um, if the child is his. So that's the only time we talk about DNA. But coming to this side of the world, it was a different ball game. I was working with a department in Florida, and then I had four friends. Out of fun, they decided to take an ancestry. And taking an ancestry test, I they were my friends, and these are Black Americans. These are Black Americans and African Americans. So I was so excited when they told me their percentage in Africa, their roots, they're from Africa, that's their root. And I was so excited, coming to me with that excitement. I was thinking, why are you guys excited? Just to discover your root? Because it's not a thing from where I'm coming from. And the excitement and the questions they start asking me was so interesting. As an African girl I thought I'm going to answer every of their questions. I, I started answering it one after the other until it came to a point they told me or asked me a question, why don't we see matches in Africa? And I paused because I knew that a lot of people in Africa have not been exposed to DNA testing. I knew that, but I don't know how to answer that question. So I paused. I told them I would get back to them. I started my research, doing research here and there. And after my research, out of curiosity, I decided to do my own ancestry test just to make sure that what those guys are saying are true. Even within me, I know it's true. I did my ancestry up to today. I have not seen any match from the continent of Africa. Yes. And I was thinking, why don't the DNA companies, prioritize Africa? Because most of their clients are Black communities. We have people from the Caribbeans, we have African Americans, we have so many people which are their clients, majorly Black communities. And they, give these guys or these folks have back informations. My friends have to go extra mile to pay more just to know their ethnicity. That's how bad it was. And that touched me. I needed to do something about that. I started researching to know if I can see something, a company, a non-profit, anything that is doing something like this, like our mission in Africa, and I didn't see none. I have to just step in and start this non-profit organization in the sense of helping the diaspora find relatives, find the truth, discover who they are is very important. And looking at that, that's for the diaspora. When I talk about Africa as well, um, this has been long overdue. I mean, it has been long overdue where you see many people going with silent feelings. They don't know who they are, they don't know their ancestral roots, even though they are from Africa, especially people born out of wedlock. They lack the real connections, they don't know the person of who they are, where they came from. We believe here that everyone needs to know where they came from. It's very important. And looking at that in an African perspective outside the diaspora, I saw that there is a need that this has been long overdue for us to do this. And I shifted my mind to something else. I was thinking, how can we use DNA to solve the problems that has been there over decades? Not because of the slave trade, but something else that concerns our health. When we look at the Black communities, a Black man does not go to the hospital except if he's sick or she's sick. I mean, that's it. We don't prioritize our health enough to talk about genetic health diseases. There are so many diseases out there that are that have eaten so many people up. Millions of Black people die every day because of genetic diseases. And to talk about it, someone was just trying to tell me how he he they diagnosed him of one a prostate cancer, and it was genetically inclined. He didn't tell any of his family members until the thing came, the disease, the son was diagnosed of the same disease. Yes. The man said, "What?" And just out of curiosity, going to the doctor, that's when we know. He said before he knew to tell his family and everything, it was too late for him, even going to the hospital. He's at the dying stage right now. He reached out to me and said, "Wow, this is a very brilliant initiative. We wish that we can create that awareness where people, African parents, Black communities, men, women, parents can tell their kids or their children, can pass that information of the genetic diseases that runs in their lineage. We don't need to wait until we go down with the disease before we can go to the hospital. Or when we go to the hospital, is at the stage where it's not treatable or it's not manageable. Because when it comes to genetic disease, it cannot be cured. Most of them, it can only be prevented or managed. So if we can see a way to prevent it, we can. So that's why I came up with this. When it comes to connecting heritage, health, and home, we need to tackle this. We need to make sure that we create the awareness and people can use DNA to test and know the kind of diseases that runs in their family. There are so many diseases or sicknesses that so many people talk about, but we don't talk about so much of genetic diseases that transferred or that runs in so many generations and has killed so many people. Just like one of my friends, that the dad woke up to something, not knowing what it is, and just like that, went to the hospital as an African man. He does not go to the hospital except if he's sick. We don't have that discussion. And the doctor told him, "This is what you're passing through is cancer, and it seems it runs in your family." He said, "It doesn't." Out of ignorance, he said it doesn't run his family. And out of persuasion, the doctor told him, "Just go and ask. Keep asking. We will know." And he went, started searching and discovered that two of his uncles died of the same disease.
Mm.
It was heartbreaking. And I can't forget what the daughter said. The daughter said, "I wish we knew. Maybe we would have prevented it." You don't need to pass through what your dad passed through. You can prevent it. And that's why this mission is here, to make sure that we can save the future generation and even save the present generation, where we will limit genetic diseases from the Black communities. Um, so that's what inspired me and what influenced me when it comes to studying AAL.
That is very powerful and very relatable. So many people know people that have perished because of disease. So you are right on with that part of the mission. My next question for you is the idea of connecting DNA to both health and identity is powerful. How is AAL expanding its outreach to people in Africa and across the diaspora?
Wow. I have said so many things in the first one. How we are trying to, reconnect Africa. with with East Diaspora and all those things, the health. But we can't do this except if we can't connect heritage, health together if we don't take a step. And what we are trying to do first, which is our main focus, is we are trying to launch a free DNA pilot program in Nigeria, Ghana, and Kenya, with plans to expand because we are trying to expand so many of um, our brothers in Brazil and the Caribbeans. They kept reaching out to us, telling us how they need free DNA kit. But we are trying to start with these three countries that are fortunate to be in our mind. And why we choose them is because of what they are doing and the impact they are creating when it comes to the ancestry, the diaspora, and trying to connect the diaspora with its heritage. So we are trying to do that, and we are working on a lot of partnerships, securing partnership with DNA companies, and just to make it easy for us, we are also trying to work with local leaders, storytellers, medical professionals to make our outreach both meaningful and sustainable.
Absolutely. AAL is the first nonprofit explicitly linking heritage, health, and home. Why is this mission critical, especially for the African continent and its global diaspora?
Thank you, Christy, for that question. I'll say because too many of us live with unknown histories. There are so many things are happening right now in the world where a lot of Africans or people with African descent wants to move to Africa. And I so much love this because it's creating a pathway where the continent of Africa will be strong. People will come to invest in Africa. And the urgency of it is people are not feeling home where they are right now, especially with um, people of African descent. A lot of them just wants to know. There's this aspect of them that really wants to know who they are. And that's why it's critical when it comes to the diaspora. We need to bridge this gap. We need to make sure that people can come home and relate with their people, know why you act the way you act, know why you do the way you do. It's not someone policing you around. We need that. And when it comes to Africa, as I said, it has been long overdue. Where people born out of wedlock has been struggling just to know who they are. In Africa, we call them bastard, and they live with it. Just like one of my husband's friends, he started 52 years old. He gave birth to he's a father, and a lot of questions in his mind through his kids, people mocking him, and this guy is confused. He really wants to know where he came from. He a lot of mocking and all those things. He's dying, and he don't know how to tell people. This generational trauma that we are talking about is real. People pass through that. And this guy, the mom will tell him, your dad is from this, your dad. I don't even think the mom knows who his dad is. That's the problem. And this man wants to do his DNA test out of curiosity and out of anger, pains that has been there for over years. But the problem is, after doing the DNA test, is he going to see any match? He's not.
Mm.
He's not. Likely he's not. Because in Africa, I mean, over 90% of people that lives in Africa on the continent have not been exposed to DNA. Maybe in his father's lineage, nobody, I mean, nobody, none has been tested. And if none, I mean, one person has been tested, he cannot get the answer he needs. And this is heartbreaking. This man is dying. So it's urgent. We need people to discover who they are. This is a mission. Even when you talk about health, we need to reduce and prevent, you know, genetic diseases. We need people to live longer. We need people to see their children. We don't need young people. You see people of 20s, 30s passing through high blood pressure. And you're thinking, what is going on? That's why this is urgently needed. In both Africa and the diaspora, there has been silence about our ancestry, about inherited disease, about trauma. So we are here to break that silence. This mission is urgent because healing starts with knowledge. And we are trying to create that awareness. And we deserve to know who we are, where we come from, the disease that runs in our lineage, and how we can prevent it, live long and strive.
Absolutely. Well, this is just the beginning of this exciting mission. What's next for AAL after this first diaspora dialogue? And how can people get involved or support the mission?
Um, there are so many things AAL is coming up with, and I'm so excited about those things. We are trying to, as I said, our main focus majorly is to start and get done with our pilot program, where we need metrics, which is going to help the medical system, the historical system, just everybody, because this is what concerns everybody. They say DNA is who we are. So we are trying to expand as well. We have the clinic, the app, so many things coming up, and also hosting mobile events which focus on healing. A lot of people needs to heal health, and we also have something that will be coming up next Sunday on the 25th, which is African Ancestry Link. So you can see it on the screen. Healing generational trauma is going to be a great event. You don't need to miss. It's going to be one of the best events. You don't need to miss. And this is going to, change people's life. Come prepared because there will be a lot of questions to ask and just get healing of that generational trauma. We also have another event which will be coming up, which is book launch. This is going to be an interesting event you don't want to miss as well. It's going to come up the next day, and it's a book launch. I have read it and I wish you will, because it's going, we need knowledge. It's going to expand your mind and for you to know who you are. So we have so many things coming up in AAL, and as of the pilot program, we are looking to partner with so many people. Um, we are It's just a way to partner with a lot of people, the health professionals, research, genealogists. We are looking to partner with hospitals. So if you want to partner with us, please reach out to us. We have our website on the screen, www.africanancestry.com. And you can also contact us through our email, support@africanancestry.link.org. Um, the website is www.africanancestry.link.org. Sorry, I think I made a mistake. So please contact us. You can also contact us through the contact list on our website. We are trying to, you can also donate for this cause. If you want to see Africa, you know, live, if you want to see Africa exploit, where the Ghana, the Kenya, and Benin have opened their doors to people with African roots. We are so happy about this, and we want other countries to, do that, because it means that with the pilot program, this countries is going to benefit more. The economy is going to boost. So if you're donating, just donate for this cause, and it will help us, to achieve our goal. So this is a family. Whether you're African born, whether you're part of the global diaspora, just know that this is a family and we are building it together.
Wow. And on my last question from you is from one of our teammates, just to kind of tie it all together, what is our vision for the next decade? You've laid out this beautiful narrative of, missing holes and gaps and knowledge that's needed for our community. But when you think largely, like, you're really dreaming big, what is our vision for the next decade?
Our vision is, we have a large vision, is to become the leading global nonprofit reconnecting. When we talk about connecting, the first global nonprofit to connect health with heritage and even home. And that say we are trying to expand our mobile DNA clinic to all African regions and diaspora hubs. And we are also trying to build a robust digital platforms that will connect people genetic wise, and we are also trying to create a localized heritage healing centers that blend traditions, African wellness practices with modern health. um, and when we talk about uh, the DNA itself, we are trying to create that awareness, um, and creating awareness through the pilot program, as I said, which is our short-term notice. And this program, this creating awareness is going to, educate people. So when we talk about educating people for our long-term um, vision, we are trying to establish a strong partnership with governments, universities, and health institutions that will help us advance this genetic literacy, preventive care, and ancestral justice in Africa and the diaspora. Because we need a lot of enlightenment. We need to create awareness. So these are just few of our plans for the next 10 years, where we are looking out for um, we are looking at where people in the diaspora can connect, expanding our DNA larger base, where people can connect with their relatives. So if you are coming from the diaspora, you can easily beat your chest and say that someone at the airport is going to meet you. If you're in Africa, you can connect with your relative that you don't even know that exists. You can discover who you are. So we are trying to expand that number where we will have millions and millions of African DNA database in the internet as other continents has.
That is amazing and so exciting. So I want to open the conversation to the rest of our team and just really think about, why we're here. How do we want to contribute to this movement? So my first question to the entire team, and anybody can jump in, what drew you to join the mission of African Ancestry Link, and why is this work meaningful to you personally? So anyone on the team can answer that question. What drew you to this mission, and how does this impact you personally? Well, I can start. I know for me personally, Black heritage and art is very important to me. I come from the humanities realm, and so I'm really interested in our art, our culture, particularly a lot of our artifacts and very precious artwork has been stolen. And, the whole concept of returning things back to the continent, that is a really big cultural shift where museums and organizations that have taken precious pieces of our heritage are now starting to return those back to us. And I think for me, being a Black person that has always been curious about Blackness, but always been told as an American, no, you can't really think about that. You have to think about whiteness. You have to prepare yourself to be successful. Don't think about that. Just stay focused, work hard, get a degree, and stay right here. But I always was drawn to Blackness, and it was always a no-no. So for me, joining this organization is really liberation, and that I get to free my mind, and I'm able to really connect with the diaspora as a whole. So I'm not in a silo of I'm just an African American over here, but I am interconnected to so many beautiful people and so many histories, traditions, and ways of life that I knew that there was some type of pull that I had with other people, but I didn't know what it was. So this organization gives me language to understand what those commonalities are and what this pull and this connection and this energy is and this curiosity for the continent. So I am just excited to just learn and to listen to other experts and start to really connect the dots about who we are as a people. So that's why I joined. And I'm really excited about the event aspect because I feel community is the missing link um, right now, just in general, across the board. We are just so busy. Everybody is just 24-hour busy. We are just, our heads are in our phones. We're constantly posting. We're constantly individualized, doing our own thing. And these events are a way for us just to take a time out, to pause, and to really be interested in one another as human beings. So I'm so excited about just the myriad of webinars, book talks, conversations like this that will allow people to just stop and reflect and really just ponder some really deep questions about our health and our DNA and our heritage and our interconnectedness. So I'm really excited about what these programs will, afford people new knowledge and connectivity. I want us to be more connected. So that's what drew me to the organization. Anybody else want to chime in before I go to the next question?
Um, so I think, yeah, I'm unmuted, I believe. Yes.
No, we can
Yeah.
hear you.
Okay. Yeah, I'm currently an ancient DNA PhD candidate. I was working on a similar concept when I met Princess, combining DNA and health, and she seemed like a really, really kind person. Like her energy was just, I loved it from the start. So I thought, why not combine forces and work together? Because she certainly has a lot of insight about Africa. I too visited last year and gained a lot as well, but combining forces really seem the way to go. I'm working on a couple other projects now as well, like the Sugarland 95 project, which is in Houston, Texas, an African American convict labor camp of interred um, convicts that were discovered recently, and working with some scientists on identifying those families. So this was right up my alley, I guess. To answer the question, our missions really aligned. So that was why I was influenced to join.
Absolutely. And my next question is, from our respective roles, right? So I'm the events director. What is your role? Can you tell the audience what your role is in terms of how you're bringing your PhD studies into the mix? What is your role here?
So I am you could say, the DNA test protocol program director. Um, and I chose that role. We had talked about it in the beginning because I do have sort of this technical capacity to design testing protocols for people, and I'm focusing now on lineal testing. So, my philosophy is you are what your father is and or your mother in a lineal line. There's a lot of DNA in between, what we call autosomal, which confuses a lot of people. But we sort of decided, Princess and I together, to focus on lineal genetics because that is the migration path for which your ancestors came. And that is essentially where you're going to find the epigenetic factors that cause us to behave in certain ways. It's called psychogenetics. And epigenetic memory is what Princess is talking about. If I break it down in a scientific way, what we're looking to understand by studying our ancestors, everything like things like dementia, Alzheimer's, these are epigenetic diseases that are passed down through cellular, you have cellular memory, essentially, just to keep it simple, that, and studies show that environmental factors along those migration paths will change the expression of those genes and cause them to express themselves differently. So you are literally your ancestors. Some of the things they may have went through, the traumas, the things that may have happened to them could be affecting your own psychogenetics and your own behavior. So I wanted to devise test methods to look deeper into the genes that are causing basically your DNA is a chemical, and through acetylation and methylation, what we call these things that affect the chemical structure of your DNA by altering the histones, which are proteins that the DNA is wrapped around, as well as the DNA itself. And those can cause lineal changes in your line that some are good. I think there's some like spiritual things like like you were talking about the woo woo earlier, Christy, just kind of, the excitement you feel about this topic, I think it's almost borderline, it's spirit. It's spirit. It's a spirit thing. We want to relate to our ancestors. And I think that along this, our lineal lines, where those migration paths went through, gave us these gene expressions that allow us on a quantum level to connect with our ancestors. And this is proven in white papers through what we call chirality of molecules. It's an entanglement feature with the way molecules express themselves. You turn one way, and it automatically turns the other one the other way. It doesn't matter the distance between those molecules. So I think there's something that affects us on a deeper level from this line, that goes back, let's say 100 generations, 100 me ago. My ancestor, according to the science, Y-DNA lineal genetics, was living in the land of Canaan, 1200 BC. And my haplogroup formed in the Middle East, but we traveled there from Nigeria about 2000 BC. So I would have never known this unless I did lineal genetics, lineal DNA testing, because the leading companies like 23andMe or Ancestry.com, it's good for finding family that's sort of immediate within the last 200 years or so. But if you really want to trace your ancestry back thousands of years, you have to do the lineal genetics, because that's really who you are. You are that migration path. So
that is amazing. And just listening to you, there's so much science and history and geography that are just intertwined together. And so just thinking about what AAL uniquely does, which is to bring all these pieces together, what do you think, our strength is as an organization to really bridge that gap between the diaspora and Africa? Like, what is it that we're able to provide? Because what you just talked about is mind blowing, and just that small description of your research and what you're into. But, how can all this that we're doing, how can it bridge the gap between Africa, the continent, and the larger diaspora? If you could just talk a little bit about that from your expertise.
Okay. No, it's a good question. I think we do need to consider the larger diaspora too, because essentially what we're talking about is going back 60,000 years at least to when the first Homo sapiens sapiens left Africa. And this includes, Caucasians, Orientals, Asians, Native Americans, Aryans, all of them left about 64,000 years ago, around Ethiopia, left out that way and went out and branched into branches. Now we can track using what we call phylogeography. And biblically, you would call these two lines Japhetic lineages, I guess, if you wanted to refer to it that way. And then there's two more, obviously, the Hamitic and Shemitic lineages, if you want to compare. As a scientist, I like to kind of play that game a little bit, but essentially you have a couple lineages that left up through Egypt that way, and then the one that carries Indians, Asians, all Asians, and Chinese, and you could say the Aryans, haplogroup R, moved into Europe. So like Michael Jackson, Muhammad Ali, even Martin Luther King is said to have haplogroup R, which is a Caucasian haplogroup. So we have to really look at this and be fair, because although paternally I'm 60,000 years away from Michael Jackson or any of them, and I'm more closer to some people like, say, Napoleon or the Wright brothers, Lyndon Johnson. They're white people ostensibly, but paternally we have a shared common ancestor that goes back 40,000 years, which is closer than you would say, than for some people who are ostensibly Black, but they're not Negro per se by the paternal line. But those features, the phenotypes and things, the way that genes are expressed, people don't know. We had a lot of people from Ireland and Scotland, Black haplogroup R, who are Caucasians, that look like Black people, came over, a few hundred years ago as, they were being kicked out but they were Black before they came over here. So there's a lot of nuances with slavery, with, just understanding, like I said, all those diaspora lineages. It's mind-blowing when you really look at the granularity and look at the details by observing what we call these phylogeographic maps that just became available to us as scientists to actually study the migration routes. And for all Africans, all of us who are under EM2, who consider ourselves West African, we left East Africa 40,000 years ago from East Africa and landed in around Ghana. And then we all left again together as a group. And some continued on about 5,500 BC. Some of those Ghanaians, some of our cousins went on to Egypt. So they were already there by 5,500 BC. And basically we turned and went on a southern path into Nigeria. And we were there for thousands of years before my haplogroup left about 2200 BC and went to Egypt and spent 430 years in Egypt, biblically, as per the description, and then emerged out during the Bronze Age collapse, 1200 BC. And then my haplogroup formed, which is EZ 1682, in 1050 BC in Israel, which is scientifically validated. So you get to learn like so much when you're using the right protocols, I guess, to go back to that. If you're just doing if you have a simplified pie chart understanding, autosomal DNA, you look at all these, things that, they say, you have 2% of this, 3% of that. But to be fair, if it's not along that migration path, then you're not really that, So I think education, teaching people exactly who they are based on those epigenetics, which I call genetic memory. These are the memories of your ancestors. The cells from their bodies were passed down individually to each one of your ancestors before it arrived to you. So that is who you are. You are the lineal genetics. Sorry I'm not sure if I answered your question completely. Oh,
no,
yeah,
you did.
Yeah, how can we understand the big picture? Yes. So my second part of that was what I discussed with Ms. Princess was that we would establish mobile laboratories in Ghana, Kenya, Nigeria, work with some of the scientists over there. Ancient DNA and forensics is becoming well known, and the governments are admitting, that there's quite a good use for it, as well as criminally investigating crimes as well as the DNA. So we will collect that DNA and create our own database for which we can create really interactive maps and entertaining sort of AI-driven, films and movies that can take your particular haplogroup and give you a visual of that pathway that that your ancestors, came through to the present to make it to you, and and make it fun.
That is amazing. And, just listening to what you're saying, I'm just really inspired to think about how we're educating people and how we're inspiring the next PhDs to come behind you and the next, geologists and geographers and researchers. So we're not just, thinking about DNA and health and our lineage, but we're really inspiring people to study this and to become the next generation of professionals that will carry this forward. I love it. I love everything that you are saying. I want to just kind of pivot the conversation because we're talking about, filling the cup of Black people and really educating them, connecting them, making sure that they know who they are. But let's talk about the dangers of not knowing who you are. What is that? How can we warn our community? Like, if we don't get on board with this movement, what are some of the pitfalls of not knowing your roots and not really being engaged in our mission?
Yeah, that is a really important question because that's why I'm doing this ultimately, is to mitigate some of the confusion out there amongst Africans, as well as it's just such a nuanced thing when you but we should totally turn it into looking at Africa as uh, the original point of the diaspora. So we can include
Yeah.
all humans in based on that, and start with Africa at the center. Traditionally, it's been more of this aggregated sort of history that the Europeans, sort of present. They don't even take into consideration that they were considered, Chinese along that same line, going all the way back to the Indians in India. So yeah, basically, gosh, I just lost track of your question.
Yeah, I even want to
But
time
just like
into
the
what
danger of not
that's
knowing who you
saying.
are.
Oh, yes. So that danger is this. There's a lot of people that, it feels good to want to belong someplace. There's people who say, and there are a lot of cases where we are Native American, but there's, most people are not going to have that DNA. Most people are not going to have, Sumerian DNA or DNA that's even Judean, like mine. But I think we can totally be proud with what we find about our own lineages. I think we have so much diversity in Africa, and we all have a path we took to make it to the present right now. And we don't really need to sort of dream about these things anymore. We can use the science to show us exactly where we came from, Um, and I think the pitfalls of not knowing, the truth is a sort of a delusion that's kind of taken hold in some of the communities that I think
Yeah,
can
I want
be.
to chime in there as well. And this not knowing who you are can sometimes people don't even know what they want until you start telling them what they want. They need it, they want it, but it's not something they have thought about. And when you remind them this is what you need and this is what you want, it brings this excitement and joy. There are so many people, there are so many lies, as James said, flying up and down the European studios. And I kept telling people we are still slaved, um, mentally, not physically, because people believe so much of lies. And it has been there for years, but I think people are coming to realize the truth. And that's what you're trying to do as well. They kept telling the the black communities in the diaspora that Africa don't need them. We don't want them. The lies kept flying. Sometimes I would check comments and it would be like maybe Kenyan people inviting them. They say, "Boy, you guys don't need us. You guys don't need us." And I'm like, who is telling you that? These are mental slavery,
Yeah.
just to divide us and kept dividing us. And they turn to Africa and tell them, Black Americans, African Americans on the diaspora don't need you guys. They are going to, they are not culturally inclined. So they're going to come to, if they come here, they're going to destroy
No.
the culture and all those things.
Yeah. No. Okay.
And mentally, we are slaved, we are divided, but we are one people. These are the things they need to know, which will bring them joy. When you know that you, where you think you're not valued, you are valued. That will help you to discover more of who you are. That will give
Yeah.
you this sense of relief.
Pardon me, I got to interrupt really quick. I've got to change rooms. Someone served, so I need to log off briefly and log back on in about 2 minutes here. I'm just going to move.
Sure, no problem.
Sure. So it's going to give you this excitement and joy. And when you know that you are not alone, you have multitude of people around you, then you are unshakable. There's this joy that it gives. And when we talk about ancestry and we talk about health as well, knowing your health is something that you can't buy anywhere.
Absolutely.
The kind of money people spend to manage a disease is not half quite of half they are going to spend to prevent that disease. So knowing someone telling you this is what you're going to pass through in the next 2 to 3 years without you dying, it has not even come. It's not like doctor telling you you're going to die in the next 3 years. start to that's a different news. But I wish the doctor would tell you these are the diseases that may occur, and then giving you the what you need to fight it, to prevent it. The nutritional values, the medical expert guidance, and all those things that you need to make sure that you are living right. What I mean, you jump and packs what runs in your lineage. I just want to tell a story. One of the directors, she's not here, came. Why she joined was because she said she was adopted. She lost track of who she is. Um, and then, she started asking, not trying to be, she don't know where she belongs. She see herself totally different from the adopted mother and father. Those the parents were lovely, very beautiful, very kind, the siblings but there's something still missing inside of her. And she said she kept looking for who she is, trying to look until she took her ancestry. And fortunately for her, someone in Africa but migrated to UK, had done her DNA test, and she was able to see a match that I think she's Sinhalese or what. And she said she has been passing through a disease that has lingered for years. She kept changing diet and all those things. It was not working until she met this family and they start telling her this is what we eat in our family just to live long. This is what I'm saying, creating awareness and passing the information to future generation. They pass that information that this family is what they already knew, what that the diseases that runs in their family, what they eat and what they should not eat. They told her, and she started eating it. She said that's how high BP left her.
Wow. That is
Yes.
powerful. And it's so relatable because so many of us as Black people, we're searching for something, information, missing pieces to our family story. And absolutely, we're trying to figure out those missing pieces. And my very last question as we begin to wrap up this hour it really goes with that story you just told. What message do you have for someone who feels lost or disconnected from their roots? And why should they take this journey with AAL? Because that is a perfect example of someone that is in pursuit of information and searching for some feeling, some connectivity, some answers. Just thinking about what it is that we provide. What message do you have for someone who feels lost or disconnected from their roots? And why should they take this journey with us?
I will just ask, maybe I will throw a question to that question. Um, the if you know that there is part of you that is missing, then you need to join AAL. You need to join this movement. You need to support this movement. If you are lost, if you so many people are lost and so many people are in search of knowledge. They say knowledge is power. Knowledge gives you insight that if you stop learning, that means you are dead. And if you are lost and you need help, then that's why we are here. There are so many people, silent trauma going on in different places, both in the diaspora and in Africa. That's why we made this to be possible. Because I don't know that there is a way when we talk about DNA, we only talk about ancestry, but we don't really talk about the health part of it. But the gene, everything you are passing through, there's something James said, even the spiritual aspect of it. There's a spiritual aspect of gene that we don't know of that relate to who we are. And that's why when we talk about DNA, we talk about that's who you are spiritually, physically, spiritual, everything. Then your environment may shape you in certain ways, but there are different things or so many gene factors that cannot be changed, no matter how you try. That's why you need to know who you are to help you figure out why you are doing what you're doing and how you can change it. Asking questions. Because when you discover who you are, it will help you to ask questions. And then people will not answer those questions except people that are related to you. And those people will be the right people to give you those answers that you have been longing for years, that you don't know who to answer it. So that's what I would tell those people.
Absolutely. And I can speak from experience being an educated American. Everybody's like, go to college, work hard, good grades, do all those things. And I did that, but there was still something missing about who I am as a Black person, because that is not the dominant conversation in curriculum. Nobody is going out of their way to go through the chapters of Blackness, if you will, and through our history. And just to hear this genetic conversation and the history and the science that, and all the STEM that is connected with that is totally left off of curriculum in the public school system. And I can say it's not, for sure, I can say it's not in private schools. I've had some dealings with private schools and working in those environments, and it's absolutely not there. There's a fear right now in America, this fear of diversity, equity, and inclusion, and erasing people and erasing history. So the mainstream is not going to do that. So AAL is really stepping up and saying, we're going to take this very seriously. We're going to guide our community through this process. And that is just very inspiring, especially for someone that has been educated in the States. I have gone through degree programs, but no one has taught me about who I am. I had to do that on my own. There was something inside of me. And now that you're talking about it, it has to be this DNA code that's in me, because it's this yearning. I'm yearning to hear the drums. It's calling me back to the mother. You know what I'm saying? And nobody is helping me to do that. And so I am just so thankful that you put this together, that we have such experts on our panel of directors to be included in this, to really help guide our community. We're really stepping into the role of elder and guiding and nurturing and making sure that we're passing down this heritage, this very specific, technical, scientific, historical information that we're not getting anywhere else.
Yes, that's just perfect. You said it all. And I'm happy that we started this, and a lot of people will be inspired, will discover who they are, will know who they are. It's not a privilege, it's a right. It's our right to know who we are, and we need to do that. Both health-wise, heritage-wise, we need to do that. And yeah, it has been a nice conversation with everybody, and so informative. I think someone asked a question which you answered. So I don't know if you have any other questions. All right.
So, Ms. Christie, have you taken a DNA test?
I have not. I have studied through my coursework, AfricanAncestry.com, and I've read about some leading Black genetic professionals through my coursework. But with COVID and everything that happened, right after, it just got away from me. But it is something that I do want to do. But you're not sure where to go. So this pilot program is really right on time for me, because I hear so many different stories about, well, don't go to 23andMe and don't go to Ancestry. And then I follow Henry Louis Gates Jr., his whole series at Harvard, Finding Your Roots. So I'm really, inspired by those interviews and how he kind of goes back and he surprises folks. They're like, what? That's on my family tree? Right. I didn't know that.
I think even they are missing kind of like, okay, for context, Louis Gates is haplogroup R too. He's also a Black European, a Euro Moor.
Wow.
And that's confirmed. So it's this interesting dynamic where you have to kind of look at things differently. And I think everyone, white or Black, will, because basically my thesis is that skin colors are not really a direct indication of your lineal ethnicity. You can have white people who have the same haplogroup as us. They come from the same line, but interbreeding has changed their phenotype, the way that they look. So like I have 250 testers that have my same haplogroup that live currently in Saudi Arabia and UAE and Bahrain and in the Middle East. And they all look Arab and European, but their roots are Nigerian. You know, they come from the same place all of us do. Like, so you can't really just look at phenotypes only and expect to understand where a person came from. So that's kind of the point of this. The whole world has to kind of learn to see race a little bit differently, because I mean, when AI gets a hold of, you know, all of this new data,
Yeah, it's going to be enlightening, creating that awareness. And there's something you said, Christy, that touched my mind about education, the curriculum that people don't have, especially in private schools. I mean, in universities, that's what you're trying to do a long time, where we introduce a course, any course, it can be AL or whatever, but we need to introduce who we are, genetics. I learned genetics in my university days because I studied biology, but it's not this. There is something about this that we need to connect to universities, to primary school, people, even to kindergarten, colleges. People need to start, learning history, learning who they are on time. That will create a lot of awareness and even bridge the gap. We can do it in years, but schools can achieve this in months. So that's why we are trying to bring this to school, do school testing as well, institutional testing and all those things, and create that awareness. But it's something that will come as will grow as a non-profit organization.
Well, I'm definitely looking forward to being guided by the organization to help me do my own tracing, because again, I was hesitant because you hear so many different stories. Oh, they don't really care about Black people. They're just taking your information and this, that, and the other. So being a part of an organization and movement like this will definitely help guide me on what is the proper way to initiate this whole journey. Like, where do you start? How do you do it? So I will be able to answer that question moving forward, and I can talk more about my RTM and what have you. I'll be able to say that too. Who's my tribe and all that. So
oh yes, and to even make sure that our data is confidential. So when we are having this pilot program and visiting Africa and all those things, we are trying to preserve African data because that's what we need. We need the DNA representation of Africans in the database, and we need to preserve that. So having that confidence that your data is preserved and is going to the right people that needs it is very important as well.
Absolutely, that trust. And I think that that's exactly what we're here to do, is to build trust and build community and make people feel comfortable being vulnerable, because this is vulnerable. Like, to really to just strip yourself down and to think about who you're connected to. And maybe there are some pain points, adoption, maybe you were born out of wedlock or whatever the social stigmas may be.
That's what I found out about myself.
There's a lot of fear of like, if I do this, I'm going to open Pandora's box. Like, I'm going to really get the truth. Am I ready for the truth?
Yes.
So to have us here to help guide people and reassure them that they can do this and that this is a good thing, it's amazing.
Oh, correct. And that's why people don't forget to attend the next event, which is healing generational trauma, because so many people already know, even living with their own father, that their father is not their biological father. So there's this kind of fear of not even knowing what to do, fear of the truth. But the fear of the truth will bring healing. And that's what you're trying to do. You need healing. And just the truth it's going to be maybe chaos at the beginning, but there will be peace at the end.
Exactly.
Well said. Well said. Well, on that note, we have had a wonderful conversation. Thank you so much for tuning in. Thank you, Princess, for your innovative thinking and putting this organization together and bringing together such a wonderful board. All of our members aren't here today. We have some outstanding individuals that contribute to the work. And we are just so excited to be here to work together and to serve you, community. So stay tuned. Make sure you join us for our next event, the Healing Circle with Miss Gloria. It's going to be fabulous, talking about how do we shed and heal from this generational trauma. And she's going to put us up on game and help us to start that process so we can be better human beings, for sure.
Correct. And also, please follow our social media handles. It's very important just to know what is going on in AAL and with AAL. All right. Thank you, everyone.
Bye, everyone. Thank you.
Righty. Take care, guys.